Hello, and thank you for inquiring about my practice in Hoffman Estates, Illinois. My name is Dr. Enrique Seguil. Everybody knows me as Dr. Rick. My practice is called Integrative Medicine, and I take care of folks locally. I also take care of people outside of the state and outside the U.S. The objective of what I want to do is to fulfill my calling to make people healthier. In many cases, you can use medicines to get to that goal, or you can also deploy many different non-medicinal ways to get healthy. We all want to increase our longevity and increase our health span. Those are big buzzwords now, which essentially means that you want to not die young and you don't want to have diseases and suffering while you're staying alive. So there's a little bit of a disconnect, which is why people, hopefully like you, are looking to seek me out, or at least an integrative and functional medicine doctor. So I'll start out with saying what I do and how I have been trained. I went through medical school in the Philippines. I came over to the US and then did a surgical transitional residency. I decided that surgery wasn't for me, so I entertained family medicine, primary care, which was really hot back in the 90s. The amount of education that was given was fair, but I think I still needed more input, more knowledge base. So I took on a sports medicine fellowship, that's postgraduate training. And then even after that, I took on becoming a certified acupuncturist out of UCLA. I applied it to my practice in Illinois. I enjoyed the concept of learning about traditional Chinese medicine and adding it to my knowledge base. Unfortunately, I still had a sense I needed more information, so I applied and was accepted at the Integrative Medicine Center in Arizona, now known as the Andrew Weil Integrative Medicine Fellowship. Through that, in addition to other things I have entertained, like becoming a yoga instructor, I have morphed my practice from a standard doctor, primary care, to something where I do lifestyle medicine. It essentially involves knowing how to use Western medicine, prescriptions and surgical procedures, but also knowing how to deploy and pull levers for exercise, nutrition, sleep, maybe even mindful practice. So there's many different measurements that we can use in Western medicine. But unfortunately, as you probably know, if you've been to a doctor visit, the only thing that gets managed with your doctor visit is what gets measured. With the speed of insurance-based wellness exams and primary care, unfortunately, we have to be swift and economical with the time spent in the exam room with you, the patient. It translates out to roughly 15 minutes a person or a visit. I do believe that if the doctors are well trained, they can deploy algorithms and figure out, okay, for number one problem, do this. Number two problem, do this. Number three problem, do that. But typically, that's usually all 15 minutes will afford. Unless the doctor goes over the 15 minutes, and some of my colleagues do, you have to understand most of us are employees. Just like working as a mechanic for a car dealership, if you see one car and fix a rattle or an engine or a flat tire and it takes you an hour, you're not going to make too much money for the car dealership, and they're going to look for somebody else who's faster. It is a business, and you have to acknowledge that. However, it's also a calling, and we have to acknowledge that as doctors. And do you really do justice to somebody seeking out your care if you put everybody into a cookie cutter, an algorithm? It does help with speeding things up, and I have to say that in the United States, we are very good at acute care. Being in the ICU, intensive care unit, being in the CCU, cardiac care unit, being with a surgeon, being in an emergency room, on a stroke floor, they're all important because they do take care of people with suffering. They do take care of older people. They do take care of younger people. So our acute care model is very good for rescuing and saving lives. But it doesn't necessarily improve health span, meaning that you might temporarily stop the suffering, but if you don't change and find the root cause, another buzzword, root cause, if you don't have a root cause analysis, then the suffering will return or will expose itself in a different light. If you don't make any course corrections, you're still going to either suffer again or you're going to die sooner than expected. And we all want to live and see life, but you just don't want to live with poor memory or shortness of breath or chronic pain. That's not a way to go. You deserve more than that. And that's why you're obviously seeking somebody out like myself. So that's one of the strengths of United States healthcare. One of the weaknesses would be that the training myself and my colleagues go through in postgraduate is a little limited. It's good enough to start practicing and healing people. We still go forward in reviewing, understanding, learning. I still dedicate at least an hour a day to learning new concepts or rehashing old concepts and fine-tuning them. It does take a vast knowledge base of training to be able to implement change. And again, if the only thing that we can implement and manage is based on very basic entry-level blood tests, then the likelihood of you stopping your suffering is fair. The likelihood of you reversing disease is probably low. The final roadblock would be that medical insurance usually doesn't reimburse doctors or facilities for those measures that are out of the box or more indicative of, okay, where do we go from here? And that can be in higher level tests. Instead of, say, a 4-panel cholesterol that's calculated, you do a cardio IQ panel that has 5 different measures aside from the 4 and very specific because it's all data-based or data-driven, randomized controlled trials. It's just that if it's not paid for by insurance, then usually your provider won't order it for fear that you'll be stuck with a big bill. We learn to use the medical insurance we pay for out of our paychecks every 2 weeks. We learn to use that as the only foothold to staying healthy. Staying healthy usually means get in front of your disease process, work towards changing lifestyle or lowering weight or lowering blood pressure or even checking blood pressure, seeing what your strength is, looking at what your nutrition practice is per day. What is your mindful practice? Do you get great sleep? Unfortunately, those are the roadblocks that do exist. I don't have a solution for fixing them, but I do have a solution for how I would take care of my patients as far as healthcare guidance, how to reverse disease, how to declare problems and limitations, acknowledge your strengths and weaknesses, and then move forward to reverse the diseases that have accumulated up until the point where you see me or another functional medicine doctor. I don't like the term functional medicine because it sounds like it's very narrow-minded, whether they're MDs, PhDs, or they receive their doctorate some other way. I think there are a lot of doctors out there, and it is confusing as far as who is who. It's important to get to know who is going to be on your team, possibly like myself as your team captain. I do try my best to design a personal plan for you. When it's personally designed, it does take time, and that's why my practice is membership driven. We are changing constantly and evolving to stay viable as far as a practice and have people from all across the world empower themselves to be successful with lifestyle change. At the same time, it is a business. And as I alluded to earlier, the current model is that you are going to be employed as a doctor and you have to produce numbers as a doctor. In my practice, we do have to follow the rules as far as how medical insurance reimburses us for the services that are elected. But because I spend more than 15 minutes, anybody that comes to see me will attest that I usually will go to the 60-plus minute mark as far as trying to problem solve. I don't want to waste your time and I don't want to go bankrupt, but we do want to make it fruitful for our time together, whether it's in the office, even virtually. Your time is very precious. The time I spend with my patients is very important to me. And if we honor both ideas, we will hopefully come up with a very good plan that's personally designed for you to be successful. And it is a bad business model for me to make everybody successful because you won't come back and see me anymore. But I assume that if you have good success, others will notice it and they might follow in suit. Maybe ask you about where did you get this information and how did you get to that weight? But this is my calling and I feel that I have to provide for the community I live in, others that are seeking a more fine-tuned way to bring back health. So in my model, I will offer at this point in time, in 2024, 2 forms of membership. One is to test out and have a single consult with me, and hopefully that will work to your advantage to know how I operate and be confident in the suggestions I give. And I will usually break down our single consult visit to preload the visit with as much data as possible looking over your old data that was ordered by your primary care doctor, your specialist, in addition to possibly getting and attaining new data before our visit. I think that's fair, and hopefully you will take advantage of my suggestions and start moving forward. The other memberships that are offered are annual memberships, where you just pay a one-time fee or a quarterly fee. In all cases, ultimately, the memberships that I offer are to balance the reimbursement that is provided by your medical insurance, in addition to allowing me as your doctor to figure out, develop, and design new ways that we haven't thought about before with the knowledge base I have and the experience that you have. I think teamwork and proper utilization of resources will make your efforts easy and achievable. Depending on the roadblocks and the resources, I may be using other people to enter into and join our team to accelerate our chances of reversal and give you the best guidance to sustain your success and get ready for the next roadblocks that might be coming your way that I can anticipate. So the bottom line is that please don't let your medical insurance premiums and the limitations of medical insurance define where you go from here. Try to think outside the box and put together a team of providers and healers that will listen, contemplate specifically for you a personal plan to implement, sustain, and maintain for the long run. I hope this information serves you well, and I look forward to becoming part of your team. But if you have any further questions, please send them to the email provided, and hopefully we'll be able to elucidate further to help you make the right decision. In the comments section associated below, you'll be able to see the fee structure for joining and becoming a member. Thank you for your inquiry, and stay healthy.